have this thing. Saves me a lot of spinning around to change the slides and stuff. Seems to be working. Okay, digestive system. We are essentially a long tube. We're about 36 feet long, but we're all coiled up. So we are giant, very sophisticated worms. Stuff goes in one end. It is processed at every stage along here and then comes out the other end, and you absorb your nutrients. You get rid of some waste material. The liver produces bile, which not only helps you digest fat, but it removes toxins and things from your blood, bilirubin from broken down red blood cells, and excretes it that way. So like the kidneys filter your blood, the liver also has a big filtering job to do by taking stuff and putting it into the GI tract to get rid of it. The alimentary canal is another term for it, although there are very few medical terms that use the term alimentary. The gastrointestinal tract is very commonly used. Gastrointestinal problems. Gastro is stomach, intestines are intestines, entero is small intestines. So gastroenteritis means your stomach and your small intestines. Your colon is colon, colono. And so those are really the main parts of the digestive part. Accessory organs, the salivary glands, moisten your food, provide some antibacterial agents. They help calcify your teeth. And they also supply salivary amylase, which is your first digestive enzyme. It helps to digest starch. So that's an accessory gland that dumps stuff into the GI tract. The liver produces bile, which is required for digestion of fat. It makes it, it stores it in the gallbladder, and then when fat shows up, your gallbladder squeezes, and out comes the bile to help you digest your fat. You have bile ducts that take the bile from the liver to the gallbladder and from the gallbladder to the intestine. The gallbladder then has a cysto terminology in it because it's a fluid-filled sac like your bladder is. And the pancreas is a hugely important organ. It not only makes insulin and glucagon to control your blood sugar, but it produces lots of digestive enzymes to digest carbohydrates, fats, and proteins. Ingestion is the process of taking food in. Digestion is breaking it down into small enough molecules that you can absorb them. Absorption, then it has to move across the membrane into the bloodstream. Elimination, the removal of what's ever left over. So looking specifically, we have the oral cavity, of course, connected to the nasal cavity in the pharynx, in the back of the throat. There was that one question that said, well, you know, both air and food go through what? The pharynx. After that, it splits off and food goes one way, but in the back of your throat, air's going there, food's going there, whatever. It goes down the esophagus. You have a sphincter, an upper and lower esophageal sphincter that open when food goes through and then closes afterward to keep gastric juice from coming back up in your esophagus or up in the back of your throat. People who have insufficient sphincter activity will have reflux disease. Liver, big, major, heavy-duty organ. One cool thing about the liver is about the only thing that will truly regenerate. If you give somebody a lobe of your liver so they can live, because they don't have, they have hepatitis or something and need a liver transplant, you'll grow a new lobe. You know, you don't do that with anything else. You remove part of the colon, it just, you know, it'll heal, but you won't grow a new piece like that it was taken out. The stomach, the body of the stomach, the fundus is the top, the pylorus is down here, and it has a pyloric valve that lets the stuff go out. Like in the developing fetus that we saw, you can have a pyloric stenosis that has to be operated on and loosened so their food can come out of their stomach and enter their intestine. 3 parts of the small intestine. The duodenum or duodenum first. It's just a couple, 3 feet long. Then the jejunum, which is even longer. And then the ileum, which is the longest piece. But in fact, most of your digestion happens in that duodenum. When the food first enters the intestine, that's where the bile dumps in. That's where the digestive enzymes come in from the pancreas, and everything starts working very quickly. You go through the small intestine, you wind up at the beginning of the large intestine, or colon, at this bulb-shaped thing here called the cecum. The cecum is the first part of the large intestine. And where the small intestine enters the large intestine, since it's the ileum, is the end of your small intestine, and the cecum is the start of your large intestine, you have the ileocecal valve. And it helps keep stuff from going backwards. Off the bottom of the cecum is your appendix, hanging off the bottom. Useless in today's terms, except if you like having infections and having your appendix out. You have the ascending, transverse, and descending colon, 3 main parts. The sigmoid colon, which is S-shaped. The rectum, and the anus. At the top of the rectum, you have a sphincter that is an involuntary sphincter that, when your colon is full enough, will open and let feces move down into the rectum. Then you have a voluntary external anal sphincter, or that you can control for a while. So as soon as product moves down into the rectum, you feel like you need to go to the bathroom, but you can control it with the external sphincter for a while. It's the same way the urinary tract works. You have an internal sphincter that will open. When that does, you feel like you need to go, but you can control it with the external sphincter for a while. The liver produces bile, comes down the bile ducts into the gallbladder, which stores it and concentrates it. Upon signal, the gallbladder empties bile into the duodenum to help digest the fat. Meanwhile, the pancreas will be emptying pancreatic digestive enzymes into the same place, and so they come together into the duodenum to start digesting the food. We know what the mouth is, but we're going to have medical terms, of course, for all of these. The palate is the top of the oral passage, or oral cavity. The hard palate are the 2 palatine bones that can be unfused if you have a cleft palate. In the back of your throat, you have the soft palate, which when you swallow, it kind of goes up and spreads and blocks off the passageway so food doesn't go up your nose. In the middle of that is the uvula, the little hangy-down thing, and it spreads out and becomes kind of part of the soft palate to keep food from going up, so it turns down the pharynx and goes down into the esophagus. Tongue is primarily voluntary skeletal muscle. Tons of muscles under and beside, and you have muscles that will pull your tongue out and back and down, but your tongue itself is a muscle too. So it's very, dexterous and coordinated, and of course is needed for taste as well as speech. The back of the throat is the pharynx, and it has 3 sets of circular muscles, a superior, middle, and inferior constrictor, that when food goes back there, it will squeeze, squeeze, and squeeze, and push the food down into your esophagus. Esophagus is about 10 inches long. Tube, it has this peristaltic activity that pushes the food down past the lower esophageal sphincter, which is signaled to open just as the food arrives and close afterward. Stomach stores and mixes. It can relax and stretch to hold relatively big meals before you feel full. So it can be contracted around a small amount of food or relaxed around a large amount of food. It's a good process that you have. The fundus is the top part, just like the fundus of the uterus. The body or corpus is the middle part. The antrum is a really muscular part that helps push the food through the pylorus, through the pyloric valve into the duodenum. Pyloric sphincter into the small intestine. Digestion and absorption happen primarily in the small intestine. The colon, you absorb a few nutrients, mainly some electrolytes, but primarily you absorb the rest of the water, because all the time the food is going through your GI tract, it's called chyme, it's liquefied. So it's liquid until it reaches your large intestine, at which point you start squishing out all of the water so that it's a solid by the time it comes out. So you're able to save most of your water. Only about 100 milliliters a day comes out of moisture comes out with the feces. Duodenum, jejunum, ileum. Short, medium, and long. But the most important is the duodenum, just maybe, it says 10 to 12 inches. It may be a little longer than that, but not much. Large intestine is the colon. So there it is again. There's all of it. The cecum, remember, we're going to have a problem there if there's a problem with the ileocecal valve or if you have appendicitis. The colon, ascending, transverse, descending, and sigmoid. The rectum, the last vertical part down in the pelvic cavity to the anus. These are called Hofstra, these lumps here. Each one kind of squeezes individually, so the pulsation properties of the large intestine, instead of strictly being called peristalsis and segmentation like in the small intestine, it's called haustration or haustral shuffling. Haustra. You won't be asked about that. They haven't mentioned it. But the haustration mechanism, it should squeeze out, water. And then they all kind of squeeze at the same time and move everything to the next area. Salivary glands, saliva. Liver produces bile. The bile ducts carry the bile. The hepatic ducts carry them out of the liver to the gallbladder, and then the common bile duct comes out of that and goes down to the intestine. Pancreas, gallbladder, we talked about that. The peritoneum is the sac lining the abdominal wall. So not the perineum. The perineum is the area between the genital area and the anus that you have to keep clean. That's different. The peritoneum is this sac that encases all of your viscera except the kidneys that are on the outside behind it. Each of these areas is cut off by sphincters. You swallow, this one opens. Goes down here, this one opens. Mix it a while, this one opens. Goes down in here, this one opens. Down in here, this one opens. So it's compartmentalized. So now what are we going to call those things? Ano, anus. So pertaining to the anus is anal. Antro, the antrum of the stomach, that really muscular area. Ceco is for the cecum. Col or colono is the colon. So you can have colon cancer or you can have colonic, inflammation. Duodeno for the duodenum or duodenum. Entero is the small intestines. Remember that, gastroenteritis. Everybody knows that term from just life, and that means your stomach and your small intestines. Esophago for esophagus. Gastro, stomach. Gastric juice. Ilio is for the ileum, jejuno. The stomato is mouth, and so is oro. You can have oral hygiene, oro. But stomato, remember a stoma, like a colostomy. A stoma is like you giving yourself another mouth, is what it actually is saying. So stomas, because stomatitis is the actual term for inflammation of your mouth. There aren't a whole lot of things that we use stoma for your mouth, but when we do, you got to know what it is. Procto is for the rectum. Why they couldn't use recto more often, but you can have a rectal exam. But a proctologist is somebody who works on that end. Sigmoido for the sigmoid colon. Abdomino is for the abdomen, but so is celio. Where that one came from, I don't know, but celio we're going to find with a couple of terms. And laparo, we know that because laparoscopic surgery, you take a little scope and stick it into the abdomen, and then you do stuff in there without making a big cut. Appendo or appendix. Cilio is your lip, kind of like close to your cheek. Cilio, lip. Cola is bile. Cholangio, then, is a bile vessel of some kind, because angio is vessel, right? Most of our vessels are blood vessels. So angiography, angiogenesis, angiomas. But if it's a bile vessel, it's cholangy. And if it's the common bile duct is choladuct. It's bile duct. Thank goodness the duct sounds like duct. Diverticulo is diverticula. We'll see those. Those are outpouchings of the colon that are sometimes painful and sometimes inflamed. Gingivo is gums. We know gingivitis is gum disease or gum inflammation. Glosso is your tongue. All of your tongue muscles are hypoglossal or something glosso type, and your glossopharyngeal nerve, helps operate your tongue. Also linguo, it means speech, sort of. So linguo works for the tongue. We know hepato is the liver. Hernio is a hernia. So is seal. But, this kind of hernia is often called a hernia, not a seal. Palato is the palate, and the roof of your mouth. Pancreato, peritoneo, polypo. You get intestinal polyps or colon polyps that are usually precancerous. Pyloro is for the pylorus of the stomach. Cialo is salivary. It's almost spelled right. Cial, like Chilio for your lip, kind of close to the cheek. Cialo for saliva. Steato means fatty. So you can have a fatty liver, you can have steatorrhea. If you don't digest your fat properly, your stools will contain a lot of fat and they'll be runny. And so it's called steatorrhea. Uvulo for the uvula. Here's diverticulum as one. Diverticuli are multiple ones. Colon has a tendency to outpouch as you get older. If it's just there, you don't notice it. It's called diverticulosis. It means you've got a condition of diverticula. They're not good, but it's not a problem until it becomes diverticulitis, in which case it becomes really painful. If these become inflamed, they become painful. Couple types of hernias. Most common, especially in men, is this inguinal hernia, because the inguinal canal, where the testes descend through at birth, never really closes up, and it's a hole in the abdominal wall that's always somewhat weak. And when you pick up stuff that's real heavy and push really hard, you can tear that, and it doesn't like to heal by itself. You have to go back in and have it stitched back up. A lot of times they put a little piece of like nylon mesh to stitch the tissue to. I've had a hernia operation. And what's bad is if part of your intestine sticks through, it can become strangulated and kill that part of the intestine, and it can be lethal if you don't do something about it. Your intestine has to be contiguous, and you can't dump intestinal contents out into the cavity here. Umbilical hernia we saw before, omphalocele. And a hiatal hernia is when part of the stomach sticks back up through the diaphragm, because there has to be a hole in the diaphragm for the esophagus to go through to reach your stomach. And if the hole's too big or there's too much pressure down here or something, part of the stomach can herniate up through that, and that's what's called the hiatal hernia. Hemi means a half of. So you can have the right half or left half. Kind of like unilateral, but they don't have to say unilateral. They say hemi something or other. Pepsia refers to the peptic juices produced by the stomach, which contain pepsin, which is a digestive enzyme. What form means polyp? Polypo. Pretty easy. But nasal polyps, if some people have to have sinus surgery to remove polyps, if you get so many polyps in here that it blocks your airways partly, they go in and kind of suck them out and heals up afterward. So, here we can have omas, we can have itises, we can have lithiasis. If you got rocks in your head, you have rocks somewhere. Craniolithiasis. So, appendicitis, we certainly know that one. Cholangioma would be a tumor of the bile ducts, bile vessels. Colic cystitis. Gallbladder is the colic cyst. Your bladder is just cysto, but the gallbladder is colic cysto. Okay? It's because it's the gallbladder version. Choledochlithiasis. That means gallstones. Cholelithiasis means gallbladder stones. These are actually not, these are stones in the ducts. You know, it's in the bladder, gall ducts, bile ducts. That's what I'm trying to say, bile ducts. Cholelithiasis means the stones are in the gallbladder. Colitis, inflammation of the colon. Diverticulitis is when those little outpouches get inflamed and become painful. Diverticulosis just means you have some of them. Esophagitis, inflammation of the esophagus. Gastritis, inflammation of the stomach. Gastroenteritis, the stomach and small intestine. Gastroenterocolitis, everything is inflamed. Gingivitis, your gums. Glossitis, your tongue. Oh, some part of that got blocked off. Cholelithiasis, bladder stones, gallbladder stones. Okay? If it's in the bile duct, it's choledocholithiasis. At least it's all showing down there. Hepatitis, we've seen before, inflammation of the liver, usually caused by a virus. There are some bacterial hepatitises too. Hepatoma would be a liver tumor. Palatinitis, inflammation of the roof of your mouth. Pancreatitis. Peritonitis, the lining. Polyposis, polyps, a condition of polyps. Proctoptosis. What's optosis? Sagging out of position. So proctoptosis can happen like a prolapsed uterus, a prolapsed bladder. You can have a prolapsed colon. Everything can fall out if the hole's too big and your muscles aren't strong enough. What's a rectocele? Herniation of the rectum. It can push against the vagina, it can push against the gallbladder, it can, might have to be fixed. Sialolith, a salivary stone. You can actually get stones in your salivary ducts, salivary glands. Steatohepatitis, fatty liver. Uvulitis, back of your throat. Inflammation of a structure of the mouth. Uvulitis. Wouldn't be unless your mouth is in an unusual place. Some other things you can have, adhesions. All the intestines are coiled and touching each other. If they inflame or get damaged or something, when they heal back or grow back, they can stick to each other in ways they're not supposed to. You can get adhesions. Celiac disease. Remember I said celio is one term for abdominal, stuff. Celiac disease is gluten sensitivity that causes an inflammation of lots and lots of stuff in there. Cirrhosis, liver disease, most commonly caused by chronic alcoholism. Crohn's disease, an autoimmune attack on your intestine that keeps it inflamed all the time. The signs and symptoms are very similar to gluten sensitivity. Everything's inflamed, you can't absorb your food well, you have diarrhea, you have a lot of pain. A lot of people have this, gastroesophageal reflux disease, GERD. That means that your stomach contents occasionally squirt past the lower esophageal sphincter into your esophagus. Your esophagus isn't really protected from stomach acid very well, so it starts eating holes in your esophagus and can give you an esophageal ulcer. Hemochromatosis, you have too much color, but it's too much iron. Iron makes your blood red, and too much iron in your blood caused by an overabsorption in the GI tract of iron. Hemorrhoids are herniations of veins in the rectum and the anus, and even externally sometimes. Looks like blood, right? I mean, they're red because they're a bulging blood vessel. Here's a couple of ones that are maybe new to you. Ileus is a term that means a improper or lack of movement in the intestine. If you have a part of the nervous plexus that goes through the intestine is damaged, disrupted, or genetically out of order, the food will stop here and you'll have a blockage because you don't have the intestinal movements to take it to the next place. So an ileus is an improper or lack of movement in some part of the intestine. Intussusception means that part of the intestine kind of gets shoved inside the part above it. They call it telescoping. And it can block off the blood flow from part of the intestine that's crinkled too hard in the wrinkle. We'll see pictures of it. Irritable bowel syndrome is a very painful disorder that keeps the bowel irritated all the time. And if you can't find other specific causes for it, such as Crohn's disease or something like that, it gets the name irritable bowel syndrome. Obesity, over a body fat of about 30%. Remember, pepsia, peptic and stuff refers to stomach contents sometimes, or the wall that makes stomach acid. A peptic ulcer tends to be in the stomach, or it can be caused by the stomach acid going into the duodenum and causing a duodenal ulcer. But it's the stomach acid that is causing the ulcer to happen in the stomach or the proximal intestine. A polyp, we know what that is. Ulcerative colitis, inflammatory disease in the bowel that causes a wearing away of the lining of the bowel so that it causes ulcers to occur in the intestine, in the large intestine. A volvulus is a twisted intestine, especially twisted bowel. And if it obstructs the flow, you have an obstruction, it has to be surgically fixed. It can also, twisting anything, you can block off blood flow as well and wind up with some necrosis of the bowel, which becomes life-threatening. Common sites of peptic ulcers in the stomach, in the very proximal duodenum, usually not farther down. What normally happens is right around in here where the stomach acids are concentrated, and when they first dump into here, the juice from your bile duct and from the pancreas contain a lot of bicarbonate. It's supposed to neutralize the acid because this isn't any more protected from acid than this is. So you don't want untreated stomach juice here or there because it can start eating holes in the wall of the intestine. Couple of really common ways that this can happen. You can either make too much acid, which is what they thought was the problem all along, or you can destroy your defense against acid by taking too much aspirin, which actually eats away or decreases the protective mucus layer that protects your stomach, or H. pylori, Helicobacter pylori. It's a bacterium that we actually all have in us, but it's under control by other bacteria, helpful bacteria and stuff. But if it proliferates and becomes too much, it eats the mucus too, makes the mucus layer so thin that your normal amount of stomach acid starts eating holes in your intestine. So some stomach ulcers or gastric acid problems can be solved by taking acid blockers. Other are best solved by taking an antibiotic to kill the H. pylori. Surgical terms: abdominocentesis, take out some fluid. Abdominoplasty, anoplasty, antrectomy. What was that? Antrum, which is that muscular lower part of your stomach. It's probably stomach cancer. Appendectomy, celiatomy. Remember, celiac disease refers to the abdomen. Celiatomy is a cut into the abdomen. Cheliorrhaphy, a stitching, suturing repair of the lip. You split your lip, you have to sew it back up, or if you have a cleft lip, you might have to fix it back. Cholecystectomy, removal of the gallbladder, cholecyst, gallbladder. Choledocholithotomy. Where are you cutting into? Where are you going in here? The bile duct. So it's the bile duct to remove a stone. Colectomy, remove part of the colon, either from necrosis or colon cancer. Colostomy, you're making a new opening. If you have to remove part of the colon, it doesn't attach to the anus anymore. You take it out of the body, you put a bag, and you have a colostomy bag. Diverticulectomy, taking out those little out pouches. Enterorrhaphy, what are you doing? What's rhaphy? Suturing it up. And what are you suturing? Small intestine. Esophagogastroplasty. So what are you doing? Repairing esophagus and stomach. Maybe because of a hiatal hernia or something that's, causing damage at the esophageal and gastric junction there. Gastrectomy, taking out the stomach or part of it. It might be because of stomach cancer. It might be bariatric surgery, which is designed to help you lose weight. People sometimes have a big chunk of their stomach removed. Gastrojejunostomy. Well, what if you had to remove the the duodenum because of cancer or something, and you had to create a new opening from the stomach directly to the jejunum? Gastroplasty, gastrostomy, gingivectomy. If you have really bad gum disease, they remove part of the gum tissue. Glossorrhaphy. What if you land and bite your tongue in half? And they have to sew it back together. Hemicolectomy, removing one side of the colon for colon cancer or something, but you don't have to remove the whole thing. Herniorrhaphy, sewing it up. Ileostomy, a new opening for the ileum. Laparotomy, just a cut into the abdomen. Could be celiatomy, laparoptomy. Remember, a laparoscope goes in there. Celiac disease, those are two terms for abdomen. Palatoplasty, polypectomy. Yeah, in your colon, the outpouchings are diverticula. If they inpouch, they're polyps. The outpouches are just weak places in the wall. The polyps tend to be precancerous, and they just, it's kind of like a conization. You just kind of put a little hot wire around them and take them off. So when you have a colonoscopy, which everybody after about the age of 50 is supposed to start getting a colonoscopy every several years, every 5 to 10 years. And they go in there, if they find any polyps, while they're doing it, they take them out. Pyloromyotomy. Here we are, muscle. The muscle of the pyloric valve, especially in infants, sometimes is so tight it causes pyloric stenosis, and you have to cut the muscle to loosen it a little bit. Pyloroplasty, uvulectomy. You have cancer in the back of your throat. Uvulopalatopharyngeoplasty. Taking out a bunch of stuff so you can breathe better or sleep better. Sleep apnea. Percutaneous endoscopic gastrostomy. Whew. Well, you're going through the skin from the outside. Okay? You're using an endoscope to see what you're doing, and a gastrostomy is making a new opening. Ileostomy, bringing it out. Colostomy, bringing it out. A new mouth, stoma. Colonoscopy and polypectomy. So they found some polyps in there. They're taking them off. I remember well that, and we actually thought it was kind of generous of him to reveal it, but Ronald Reagan was one of the first, in the early days of colonoscopies. He had a colonoscopy, and they found polyps and removed them, and he told the country, said, everybody ought to get these, because people are dying of colon cancer. You don't need to if you have a colonoscopy every once in a while. Kind of like the Katie Couric thing. Her husband died of colon cancer, and so she made it a lifelong push to try to get more people to get colonoscopies. Abdominoperineal resection, taking off, various parts of the lower part of the large intestine, all the way to the anus in some cases for cancer. An anastomosis, in general, in all science, is creating a new joining between two things. So sometimes it's called a stomy. If you're taking the stomach and reattaching it to the jejunum because you took the ileum out, you can use the term stomy, but you can also use anastomosis to connect a couple of tubes that will now work better that, weren't connected before. Sometimes these will be connections that you don't want to have happen. But, usually it means that you're creating a connection. Bariatric surgery is weight loss surgery, putting a band around your stomach, gastrectomy, taking part of it out. And if they don't do it, you have to bury them because they are going to die from obesity. I mean, that's not a nice way to remember it, but whatever works. Hemorrhoidectomy, removing those herniations. Vagotomy. The vagus nerves are cranial nerves. They come right out of your brain. They go down and control your viscera. They control your heart rate. They control how much your stomach churns and whatever. And if somebody has either a like a pyloric stenosis from so much stimulation, or you're making too much stomach acid. That's stimulated by the rest and digest vagus nerve stuff, and they will cut the branch of the vagus nerve that goes to some part of your stomach. A&P resection, taking out everything from here to there. So it's not just in the abdomen, it's also in the perineal area. Creation of an artificial opening would be stomy. An artificial opening is a stomy. Connecting two tubes together, which sounds similar, is the anastomosis. Cholangiogram. What are you looking at? No. Bile ducts, bile vessels. It's not C-O-L is colon, C-H-O-L is bile. So, the colic cyst, the colic duct, the, whatever. So cholangiogram, you're taking a view of the various bile ducts to see what's working. Colonography would be taking images of the colon, esophagus. Scope, colonoscopy is the procedure. Endoscope goes down your throat. Colonoscope goes up the other way. Esophagogastroduodenoscopy. Well, you're able to get down past the stomach and go into the proximal intestine. Still going down from the mouth. Gastroscope, gastropathy, looking at the stomach. Looking at the abdomen, laparo. Procto, looking at the anus, the rectum. Sigmoidoscopy, looking at the sigmoid colon a little bit farther up. Colonoscopy. There's diverticula sticking out. Here's a big polyp in the colon. Abdominal sonography, ultrasound. Barium enema. They put fluid up into the rectum with a contrast medium in it, and then they can take photos of it, because it shines. Endoscopic retrograde cholangiopancreatography. Retrograde means it would go up the rectum and go around and round and round until you found it from that side. Upper GI series, that you swallow the barium stuff and look down, you look from here instead of looking up from there. Endoscopy is, putting something down your throat and looking. Usually it's an ultrasound. Endoscopic retrograde cholangiopancreatogram. Pancreatogram. Whew. Yep. Laboratory tests, you can look for H. pylori, or Helicobacter pylori, the ulcer-causing guys. A fecal occult blood test. If you can't see blood in your feces, but you think you might have a bleed or something in there, you can have an occult blood test, and they have to look at it more microscopically to make sure that there's actually blood in there. Abdominal, anal. Remember the term phasia, onagophagia, Aphasia, you can't eat, or it actually means you can't swallow. Celiac, pertaining to the abdomen, celiac disease. Colorectal, That's the colon and the rectum. Duodenal. Dyspepsia means difficult digestion. Remember, the peptic enzymes are the ones that help start digestion in the stomach. Dysphagia means it's hard to swallow. You know, some diseases, myasthenia gravis perhaps, or multiple sclerosis, or something that causes muscle weakness or something can cause difficulty swallowing. Enteropathy would be what? Small intestine disease. Esophageal, gastric. Gastroenterologist is the doctor. Gastromalacia. Remember, malacia means softening. Softening of tissue means it's getting abnormally soft. It could rupture perhaps. Hepatomegaly, enlarged liver. Ileocecal, that valve area where the small intestine enters the big intestine. Nasogastric oral. Well, nose and mouth and stomach. Pancreatic, peritoneal. Remember, not perineal, but peritoneal means the bag that surrounds all your viscera. Proctologist is the doctor. Steatorrhea is the fatty stool. Steatosis is too much fat someplace, so it could be in the liver. Stomatitis, here's your mouth inflation. Inflammation. Stomatogastric. Sublingual means below the tongue. So you could take, if you have chest pain, you take nitroglycerin, you put it sublingual, put your little pill under your tongue. Ascites, we mentioned, that's collection of fluid in the abdomen. Starvation and things like that cause ascites because it allows extra fluid to leak out of the blood vessels and fill up your abdomen. Diarrhea, we know what that is. Dysentery is a disease that causes severe diarrhea. Emesis is vomiting. So you take an antiemetic. Dramamine is an antiemetic. You know, it's supposed to prevent vomiting. And you have to give people antiemetics if they're on chemotherapy sometimes because it makes them nauseous and they vomit up their medicines. Feces is the solid waste. Flatus is gas. Gastric lavage, flushing the stomach out. If somebody swallowed something they weren't supposed to, they might do a lavage. A lavanderia is a dry or laundry. You know, it's a washing, place. Gavage is putting a nose tube down into your stomach to feed the person, a stomach tube. Hematemesis is vomiting up blood. Hematochezia is blood in the feces. So if you remember emesis, you'll get that one for sure. Hematochezia, and I think this is the only other place we're going to have blood in something. So hematochezia, bloody feces. Malabsorption, most of your GI infections and inflammations, they swell up the wall of the intestine so that it can't absorb nutrients very well. Melena is a black tarry stool that it usually contains occult blood. Nausea, we know what that is. To palpate is to feel. You know, if your abdomen is really firm, there's something wrong in there. It's supposed to be kind of squishy. Peristalsis is the movement of stuff through tubes. Reflux, acid coming back into your esophagus. We know what a stoma is, and we know what vomiting is. What's vomiting? Emesis. Abbreviations. BOCU, A&P resection, Okay, that's taken out from the lower part of the abdomen and the anal region, the perineal region. For colon and rectal cancer and anal cancer, your cancers tend to be low more than high. Barium enema, probably should have put that on there. Esophagogastroduodenoscopy. Fecal occult blood test and GERD. These, I underline them, you've got to know those for sure. Gastrointestinal, of course. H. pylori, irritable bowel syndrome. Okay. Abdominal ultrasound. History of nausea, fatigue, and jaundice. Multiple scans show no hepatic lesions that are obvious. Numerous small shadowing calculi within the gallbladder. What are calculi? Stones. So litho, but also calculi. The gallbladder wall is not thickened, and there is no fluid collection. The common bile duct is normal in caliber, means size, cross section, measuring 4 millimeters. No calculi are seen in the common bile duct. Spleen is not enlarged. And you can't see any particular lesions on the pancreas. So the only thing they've found for sure is gallbladder stones. Upper abdominal sonogram is otherwise normal. Hepatitis. Hep A is relatively treatable. The other hepatitises that are viral in nature are very difficult to treat, and they are very predictive of liver cancer. I've had 2 friends, remember I grew up in the roaring 60s and 70s, who got into IV drugs, and they got hepatitis. They stopped doing the IV drugs, but the hepatitis was never really especially well controlled, and they both died of liver cancer. Paid in the upper right quadrant. Jaundice, you turn yellow. Hepatoma, big liver tumor. Pancreatitis, inflammation of the pancreas. You can have acute pancreatitis, which can come and go. Chronic pancreatitis is often caused by heavy alcohol consumption. Alcoholics will wind up with liver problems and pancreatic problems. You can't live without your pancreas. It does too many things. Cancerous tumor that was blocking all of the ductwork. Yeah. Yeah. Yeah, and liver and pancreatic cancers they're pretty bad ones. You know, I mean, if you catch them early, they've gotten much better, especially with pancreatic cancer. I actually know a person or two who are long-term pancreatic cancer survivors, you know, more than 5 years. Whereas pancreatic cancer used to be like 1 year and out, you know, max. So they're getting better, but they're still pretty grim.
Started turning yellow, and that was part of the thing too. That they thought, well, what's going on? And it happened so fast. I mean, one day her skin was normal. The next day it was like, what's going on? And then her eyes and everything, and boom, it was just within not even 3 or 4 days.
Man, that's fast. Well, of course, the cancer had been growing for some time, but finally it got to the point where it blocked off the ductwork.
Couldn't eat. You know, like her stools were that tarry black.
Uh-huh.
And it was, you know, like all this makes sense to me now.
It doesn't make you happy, but at least you understand what went on with your aunt.
Yeah.
Yeah.
It makes, now I know what was happening.
Because it's like when the doctors tell you and you're like, what does this all mean? Like, what are you saying? And they're just like throwing big words at you, and I'm like, I don't know what you're saying.
Well, and you guys are all going into the medical field, so of course you need to know this. But I would say everybody ought to take this. You know, I mean, because of even the things that I've been through with my parents, with my wife having a couple of serious injuries, getting hit by a truck, and, you know, I mean, you have to be able to act as an advocate. You have to understand what the heck's going on. You have to make sure there aren't mistakes being made that you could catch, because, you know, 20% of people that go in the hospital get either the wrong drug or the wrong dose. And it's not that they're careless or don't want to do better, but there's so little time, and there's so much confusion, and there's so much this and that. And I mean, they've gotten, you know, if you've been to the hospital lately, I mean, they ask you, what are you here for? They put a thing on and say, is that right? And they're doing everything they can, but there's too much ambiguity in medicine. And, you know, the more you know, the better off you are, for sure. When I went in for my knee surgery, I stayed with a friend of mine who was a doctor. He wasn't doing the surgery, but it was in Atlanta, and I was living in the Caribbean by then. And before we went in, we knew they would do it, but he took a magic marker and wrote, "Not this one," on the other leg. You know, not this one. Don't cut this one.
Oh, wow.
So here we have appendicitis. You know, it gets really inflamed, it swells, and if it bursts, the contents of your intestine fill your abdominal cavity. And it's critically serious because it's full of bacteria. It gives you just this general infection that's hard to get rid of. It can lead to sepsis. Peritonitis, inflammation of the clear bag that surrounds all the viscera. Polyposis, condition of polyps. Proctoptosis, the rectum actually falls outside the body and has to be surgically put back in. Rectocele, where the rectum is outpouching, blocking off the vagina if it's a female, or, you know, constricting the urinary tracts, pushing against the bladder perhaps, or the urethra if it pushes far enough. Sialolith, stones in the salivary glands. Uvulitis, we've all had that. Here's some terms, some of which we've already covered. We know what adhesions are when things are growing against something they shouldn't. And we'll talk about this more, but anorexia nervosa and bulimia nervosa, the term anorexia means not eating enough. or lack of appetite, really. Lack of appetite. Cancer causes anorexia. You can't get people to eat. Anorexia nervosa is the condition that especially young women have when they become dissatisfied with the way they look and they start starving themselves. And the more they starve, the worse they think they look, and they starve more, and it can lead to death. We've had famous people that died of heart failure from essentially starving themselves to death. So anorexia nervosa, you simply don't eat enough. Sometimes they over-exercise at the same time. Bulimia nervosa is eat and binge and purge. Binge and purge, binge and purge. Sometimes they don't lose as much weight because they get some nutrients, but they cause a lot of damage to the esophagus. Their teeth all, get really bad because the acids are eating away the enamel on their teeth. Cirrhosis of the liver, mostly due to alcoholism. Crohn, we know, duodenal gastric ulcers, reflux disease. Adhesions, here we have everything grow into everything else. Cirrhosis of the liver with ascites. Crohn's ileitis. Okay, so this is particularly causing inflammation in the ileum. Crohn, not Crohn's these days. Autoimmune attack of your own digestive tract. And it can hit multiple different places in the digestive tract. Peptic ulcers in the stomach or the duodenum, usually. Sometimes esophageal, if you have esophageal reflux too much. Esophageal reflux disease, where it's moving back up in here and doing damage. And your hiatal hernia, where part of the stomach is sticking up above the diaphragm. Here we have our intussusception. We're going to see that, the telescoping of one part of the intestine into another. Usually that occurs in a neonate. You'll find that the intestine, as it developed, just didn't work right, and it kind of winds up bunching, twisting, or pushing up in itself. You can have a volvulus as an older person and get a twist in the intestine. That happens in horses a lot when they colic and they roll around and all this kind of stuff, and you think, well, maybe they're going to help the food move, but what happens is they wind up twisting their intestine, and it can be lethal for them. Ulcerative colitis. So intussusception, here we're kind of telescoping back up in there, and where it's bent here, you can get necrosis from blocking off your blood flow. Gastric bypass, bariatric surgery, bypassing most of the stomach. I mean, for this to work, that pouch has to be really small. Otherwise, the person, especially if they're, if they're eating out of control, they'll just eat and eat until they stretch that little piece back out again. Yeah, it helps. The stomach has a lot of things that it does. One thing is if you can leave it in, at least it's still making the hormones and things that are, valuable to you somewhat. But the food is not processed as well. It doesn't get the stomach acid, really, to help kill the bacteria and to, help start the denaturing of the proteins. You don't get your intrinsic factor as much to help you absorb vitamin B12. So there are some things that the stomach does that you're just giving up. The good thing is that most of your true digestion occurs in the duodenum, not in the stomach. A band. it's hard to see. It looks like you would have to eat smaller amounts at a time, but you could still fill your stomach up. I'm not sure how effective the bands are. Maybe somebody knows. Volvulus, the twisted intestine. Here we have plasties, ectomies, otomies of anything you can think of. Abdominoplasty, tummy tuck. I will have to say this does look better. You know, usually this happens if somebody loses a whole lot of weight, their skin is still big. And it may take forever for it to go back away on its own, and it may never entirely.
We had a family friend that got a gastric bypass, and she was really overweight, and she got it done. She lost like hundreds of pounds, and then she had to get
A lot of skin removed,
she was
yeah.
a marathon runner, and she was just like,
Oh, wow.
she looks like really, doesn't even look like she was overweight at all, ever.
Wow, that's fantastic.
Yeah.
That's wonderful.
Really recognize him too much.
Colostomy. And here this appears to be a male, so that's probably not a hysterectomy scar, probably from having a lot of the colon removed for colon cancer, and therefore the colostomy is now coming out there. Gingivectomy, removing the inflamed and infected gum tissue. One thing is it helps you feel, eat better and helps you keep your teeth longer, but also chronic gingivitis causes cardiac disease. It's the bacteria can get into the bloodstream, and they have a tendency to cause heart infections, valve infections, and stuff. Yeah, for removing gum tissue. Yeah, because if you already have a spreading of infection, it can make it worse. I mean, you cut stuff and you release, bacteria, whatever, that would be more or less confined there to make it even worse. So, yeah, I mean, it's amazing the things that you have to get checked to have this thing removed. I had blood work done, and I had this done, and I was supposed to get an EKG, but I didn't. I told them, I teach EKG. I can look and see. Oh, yeah, all right. But there are a lot of systemic things that can go wrong. Right hemicolectomy, removing this part and then attaching the ileum to what's left of the colon. Better than having a colostomy bag. Colonoscopy, and we saw that one. Removing a bunch of stuff back here so you don't have sleep apnea. It makes me wonder, though, how careful they have to be swallowing and drinking stuff from then on, because the water would have a tendency to go up their nose. Certainly you have to be upright. I can drink some water lying on the bed, especially if it's straw or something, because, but if I didn't have anything to block it off, it would all just go right up my nose. A&P resection, we saw that one. Oops. Anastomosis, connecting, two tubes together. Hemorrhoids, external and internal, they can be removed. They usually get reabsorbed with time anyway, but sometimes they're so painful you need to have them removed. Vagotomy, pyloroplasty. So what we're trying to do is decrease the stimulation by the vagus nerves of the stomach, and in this case, loosening this a little bit so that you can empty your gastric contents and perhaps remove an ulcer. In this case, this person had all kinds of problems. Cholangiogram, contrast medium injected into the bile duct so you can look at it. Esophagogram. Sigmoidoscopy, going up far enough to see the sigmoid colon. Ultrasound of the gallbladder, finding gallstones, bladder stones, gallbladder stones. Barium enema, injecting the contrast medium so that you can look at it under an X-ray type of radiology, radiograph. Upper GI series, swallowing it from this side or looking down from up here. Endoscopic ultrasound for cancer. So putting it down your throat. Fecal occult blood test. Just finding out if there's invisible blood in the feces. Glossitis. Ouch. Nasogastric tube. You can put food in or you can take contents out. You know, if the person swallowed some poison or something. All right. That one wasn't as long as I feared. So, head back to the computers and let's work on that stuff.